Dasha, you're in rural Minnesota. A whole lot of concern about how rural communities were going to be able to handle this vaccine, especially with the freezer needs. You've been reporting on much of that. Walk us through what you're seeing today.
Well, Katie, this is the first day of vaccinations in hospitals in Minnesota. And here at Sanford Worthington Medical Center, we are about to witness the first shot here. And I know we've seen a lot of these, Katie, but for me personally, and I think for many of our viewers, it just does not get old, especially after we've seen so many tragic images on TV lately. This is that little bit of hope. Worthington is a small community of about 13,000 people, and this means a lot to them. It's been one of the hardest hit regions of the state. And so with that, I want to bring you into this really special moment here. This is Lynn. She's vaccinating Dr. Jenna Wolf, who is a hospitalist here. She's been on the front lines taking care of COVID patients. And there it goes. Dr. Wolf, how did that feel?
Painless. Hardly felt it going in.
What does this mean for you after everything you've seen these past several months?
Really, this is everything for us, not only as a healthcare system and a hospital, but for a community. Like you said, the coronavirus has really hit us hard here in Worthington and in southern Minnesota, and we've seen that in our friends and neighbors and in our coworkers here at work, the burden that it's placed on all of us. And really, this is just hope and excitement for us that, maybe we have the end is in sight, or at least we're getting closer back to that normalcy. And I couldn't be more excited to be a part of this.
And Lynn, for you, I'm going to bring you in real quick because you administered that very first shot here. How does that feel for you, seeing your colleagues get vaccinated?
It's exciting to know that we finally can see a beginning to the end of this pandemic and all of the enthusiasm for everyone to want to be able to get the vaccine.
Thank you both so much. Congratulations on the vaccine, and thank you for all you're doing as we are still in the middle of this crisis. And Katie, what's so cool is that Worthington is the hub for vaccines across this region. All day today, I saw pharmacists packing up boxes and giving those boxes of vaccines to folks from clinics as far away as 150 miles from here, communities as small as 700 people. This really is a vaccine that is getting distributed across the country. There's been so much painstaking planning that has gone into this and is now coming to fruition here, Katie.
Dasha, so amazing. I'm so glad you brought that to us, the first shot in that community. I'm just curious. I know the Moderna vaccine is going to negate much of these problems because it doesn't need to be refrigerated at the same temperature that the Pfizer vaccine does. But so far, how are they handling the refrigeration process?
Yeah, it makes things a lot more complicated, Katie. I actually watched this morning as they had a timer for 5 minutes rushing to get the vaccine out of the freezer and packed up into coolers filled with ice packs so that they could get those out to those more remote communities. And the clock starts ticking because those vaccines can only last outside of the freezer for about 5 days. And so what has to happen is precision when it comes to how many doses are delivered to each of those communities. So they have to be really strategic, make sure they send out as many doses as they will actually be able to deliver in those 5 days and then get more out as possible. But listen, every single dose counts, right? So although the Moderna vaccine is coming, the supply we need in order to get not just healthcare workers, but when it gets disseminated to the broader public, every single vial matters, Katie, whether it's Pfizer or Moderna. They're excited and eager to get shipments from every approved vaccine. Katie?
It is like liquid gold.